we've seen an increasing emphasis in this EASD on prevention, and there was a lot of interest in the RISE study. So can I introduce RoyTayler? RoyTayler is from Newcastle in the UK. Roy, you were the commentator on the outcomes of the RISE study presented at EASD. Firstly, tell me what the RISE study was.
Yes, thank you. The RISE study is all about restoring insulin secretion, or at least preventing it going off, because the particular part of the RISE study that I'll be commenting on dealt with the question of, does major weight loss prevent the onset of diabetes in people who have got pre-diabetes, or is it better to use metformin? Now, in the RISE study, Tom Buchanan and his colleagues looked at the effect of gastric banding, and they duly achieved about 10 kilograms weight loss, and that was the level of weight loss at 2 years. So they presented the data on what happens. Is it better to use metformin, or is it better to use weight loss as a means of preserving islet function and preventing the onset of type 2?
And what was the outcome?
The outcome is very interesting. From the point of view of a practical clinician, I look at the data and see, what does it mean for my patients? Now, we know that the most important predictor of onset of type 2 diabetes is the level of plasma glucose. So as that creeps up, it becomes more and more likely that person is on the way to diabetes. So when we look at the RISE data from that very simple clinical point of view, we find very excitingly the blood glucose goes much lower in the group that had the weight loss than in the metformin group. Now, it did go down in the metformin group a little bit, but significantly more in the gastric band, the weight loss group. So that's one thing. But another matter is just rolling out our new understanding of the pathogenesis of type 2 diabetes, which is a disease driven onwards by too much fat in the liver and in the pancreas. But in the liver, very potent signals are given out, because too much fat in the liver, too much fat is produced in the blood, and also the level of liver enzymes is raised. So we can look at the RISE data, and lo and behold, we see the plasma triglyceride fall way down in the weight loss group. The plasma liver enzyme ALT goes way down in the weight loss group. These are all really important markers. But at 2 years, the primary outcome of the study, which was insulin secretion, that was unchanged between the two groups. Should we be surprised about this? Well, no, because pre-diabetes changes to diabetes over a much longer time course. Between 3 and 10% of people per year will flip to type 2 diabetes. So what we see in the RISE data is a beautiful early snapshot. The writing's on the wall. We can predict that the weight loss group will do better. As yet, there hasn't been enough time for a difference in the insulin secretion to emerge. So those are the messages I take from RISE, and we look forward very much to what will happen to these groups into the future.
And does it tell us anything about how to achieve that weight loss? Because there's a huge debate raging, not only in academic circles but also in the popular media, about the kind of diets needed to achieve weight loss, whether it's 5-2 or it's high fat or low fat. Does it tell us anything there?
Not directly, because in order to get a really solid grasp on weight loss, the authors have opted to use a form of bariatric surgery, the least invasive form, gastric banding, but not everybody would want that. In terms of a dietary approach, we've got a very clear guide from the DIRECT study. So we can reproducibly get 15 kilograms weight loss after 3 months of treatment with a low-calorie liquid diet, and that's much greater than any other study has ever shown. Now, of course, there's the problem of maintaining that long term, but that's the same with all diets. And in the sense of best food to eat in the long term? Well, there's no one diet. I think that is so important to emphasize. We look around and we see people are different. They've got different preferences. Some people will suit a low carbohydrate diet better. Other people might prefer a low fat diet. And yet other people do very well on intermittent fasting. So these are established methods with a good evidence base. And if we look further, a Mediterranean style diet combined with low carbohydrate, yes, that seems quite promising. So we know a lot about losing weight now, which is get it off. Low calorie diet, defined period of time. That suits individual people so much better. So those are the important points about weight loss. But of course we can look at the RISE study as a beautiful example of weight loss and put that together with knowledge from elsewhere about different diets.
Thank you so much. Well, some really exciting news there from the outcomes of the RISE study. And if you want to see that presentation in full, of course you can do so. You can go to EASD.org.